Welcome to Conversations with the Winners. Today, our conversation is with Erica Thrash-Sall. Erica is Executive Director of McFarlan Villages in Michigan, and she's a winner of the 2021 Robert Wood Johnson Foundation Award for Health Equity. Welcome, Erica.
Thank you, Jacinta.
Let's start by helping us understand a little bit more about McFarlan Villages.
Well, McFarlan Villages is a 97-year-old organization whose mission is really to maximize opportunities for quality of life by providing safe and affordable housing and caring services for diverse older adults in Flint, Michigan. We provide affordable housing and services to our community's most vulnerable older adults. We really are committed to improving the quality of life for older adults throughout our entire community. And the organization has a large-scale affordable independent housing campus, as well as a smaller assisted living campus.
Erica, talk a little bit about how you combine services and housing together and the unique aspect of that model.
After seeing what the higher end communities had, I really wanted to create equity in aging by bringing all of these dynamic services together to serve older adults who really could not afford it otherwise, and really needed it more than anyone else, because for the residents we serve, the independent living is the most affordable option for them. Most of the people we serve could never afford assisted living, and their only option for care if they need it is in a very expensive Medicaid bed in a skilled nursing.
Can you talk a little bit more about the psychological aspect of aging and how it relates to people with limited income?
Absolutely. We serve some of our community's most vulnerable older adults. And so many, they do have actually chronic, behavioral health issues that have been undiagnosed. And for the first time in many of our residents' life, they're able to address issues of depression, issues of anxiety, loneliness, all of those things that really do contribute to a poor quality of life. And they're able to do it without shame that many people have been taught to feel about dealing with their feelings, and especially anything related to behavioral health. They have to feel that their life is worthy before they really have the real ability to address some of the physical challenges that they have.
Erica, let's just talk a little bit about something as simple as being able to go out into the community and enjoy a venue or an event for an older adult who had limited funds.
There were residents who said, I want to go. I certainly would love to be able to go places and do things, but I can't. I don't have the money. And so this whole idea of creating equity in aging, making our campus far more affordable, helping people stay healthy so that they're not spending, their extra money on things like, more medication copays or more physician copays, or even having to pay people to help care for them. Being in good health and having affordable housing, it really just enhances their quality of life. And so one of the things that we've done on our campus is everything is free. I mean, if from taking transportation on our van to going off campus on activities, we find other people who can help pay for it through philanthropy, through grants, through operations. But it has made a difference. People can look forward to doing things that they enjoy without the worry of not having enough money to do it. And that in itself, really adds, to the quality of life and health.
Talk to us a little bit about your perspective about health equity.
Well, my perspective, specifically, my work around older adults is that there is still so much life left. I think that, people really think, they're older adults, we don't have to worry as much. They still have life to live, and they need quality of life for a variety of reasons. So and when you look at any healthcare organization, the majority of people utilizing are older adults. So being able to meet people where they are, right where they are, and help them, just obtain or maintain whatever health status will allow them to do the things that are important to them makes a huge difference with no judgment. And I think, one of the things that was so important to us about partnering with a federally qualified health center is because we could take that judgment out of providing care and meet people where they're at so that their provider can design a treatment plan that really works for who they are and what's important for them. And that for me is what health equity is. Those are the kind of things that our health center has been working with our resident population and meeting them where they are and not, trying to force them in a model that just frankly doesn't work for them. And it allows them to be successful and be able to live life how they want to.
The award is also about creating health equity through systems change. Can you talk to us a little bit more about systems change?
Yes, I can. The cost of care is increasing at a rapid pace. The number of older adults is increasing, while the number of people who choose a career in caregiving is decreasing. And it's much easier and less expensive to operate an affordable senior independent living rather than assisted living or skilled nursing. And so investing in a model of preventative health or disease management and affordable housing, it saves money downstream on Medicaid and Medicare eligible older adults. And so connecting Housing and Urban Development, better known as HUD, with Department of Health and Human Services to continue funding this model of subsidized housing and federally qualified health centers is just good for everyone.
Is there one big idea you want to leave us with as we come to a close of our discussion here today?
Well, I want to talk, it's the idea of health and healthcare and housing, while folks like me who've worked in community health for a long time, we've understood, the social determinants of health and how important they are. Older adults who do not have, the means unnecessarily end up going to skilled nursing centers. And that does a lot of things. It's very costly. The average skilled nursing costs about $13,000 per year. And many people end up there because their health goes unchecked and they just debilitate. But when you couple behavioral health with both preventative and disease management, people are able to live independently, really much longer and potentially throughout their life. And so that's really it. They're able to live, they're able to get their care and do the things that they enjoy in what I call their fourth quarter of life.
Erica, you are the recipient of the 2021 Award for Health Equity, Robert Wood Johnson Foundation Award for Health Equity. What does this award mean for you?
This was really an honor of a lifetime. I have admired the work of the Robert Wood Johnson Foundation for the past 20 years when I first learned of the organization through my work with Ascension Community Health. But this recognition provides validation and prestige to our work at addressing affordable housing and healthcare together for vulnerable senior populations. And what it's given us the ability to do is to leverage it, to have conversations with, both federal agencies, HUD and the Department of Health and Human Services, so that we can replicate and scale this model.
Erica, thank you for keeping older adults in the forefront. And on behalf of LeadingAge and the Robert Wood Johnson Foundation, congratulations on your award.
Thank you so much.
Thank you for joining us for this conversation, and you are invited to more conversations with the 2021 winners of the RWJF Award for Health Equity. And you can learn more about all of the winners at rwjf.org. I'm Jacinta Goda, and thank you for watching.